Now you can have a look example. So I'll try to show you from in the image itself. Is a very beautiful image over here. You can have a look. First I'll try to show you exactly on the first image. Now this is the direct Moxibustion. What I am showing you here, there is a direct Moxibustion how need to be done. So now you just take it as a cone. But before going to that procedure, I'll try to show that procedure. Always make sure that before going to do lot of things, you need to keep it in your mind, because Moxibustion, before doing that, the fire extinguisher should be there. What is required? Fire extinguisher. Maybe all the clinical setup, Private Clinical Medical Establishment Act, whoever done the MBBS or the Ayush doctors or the acupuncture practitioners. But if you wanted to do Moxibustion or the acupuncture clinic you wanted to establish, there the fire extinguisher now is mandatory. Before it was not there. Before it was not there. But now you wanted to get the clinical registration, we required. We do have in our center, fire extinguisher is there in RT Nagar center. But now you keep it that as a safer side, that always is good. So number 2 is ventilation should be there. Proper ventilation should be there. If, sir, we don't have any ventilation, but we have the AC room, we have the AC, central AC is there. There we can do it. That also applicable. But there should be no fan. But centralized AC, okay, you just use it. But fire extinguisher should be there, or the water facility should be there, exactly to, extinguisher of the fire need to be done for emergency condition. But now you can have a look here. But the woman is sleeping here on the bed. Then there is a towel. There are the 2 towels are there. This is the towel, and here there is the one more towel. There is on the diaphragm 1 towel, below the navel there is a 1 towel. The folding towel, you keep it in the mind. Always we should have few towels in our clinical setup, right? So now there is the big cotton towel would be good. But now you just place it as a, they have to take out whatever belongs in on the chest region, especially on the abdominal region, wanted to do for the kind of the mox on the abdominal region. So you have to cover this with the towel, double folding. So once you take the entire towel and then fold it inside of the pelvic region, one folding, then outside you can keep it as a normally. But on the diaphragm, you just fold it on the diaphragm. You just take the bra or something for the female to female, and then take it this bra and then fold it like this inside, right? So why? There is a reason why we wanted to do like that. There is a reason. So I will tell you what could be the reason. So after that, once completed that procedure entirely, there is the bare stomach is there, nothing is there. Then you just take it as a moxa wool, and then you just take it as a, make it this as a, see, now I have taken this, and then you just ignite it. Once you place it directly on the skin, this is called as a direct Moxibustion. This to be known as a direct Moxibustion, but indirect Moxibustions are different. But now after placing this and then ignite. So how to use that laser? Lighter. So you, rather than keeping as a small lighter, is not good. A small lighter is not good, but you make it as a big laser, that always is good. It is inexpensive, you can keep it at our center, that is good. If alternate for that is, you can use this as a what we call as a lamp, candle. So in that candle you want it to burn, and you can burn it, but lighter will be good, because you cannot do it this. But for the moksha cone you can do it. For the moksha cone you want it to burn, you can burn it through this. But this cone we cannot use it, but otherwise you can use some agarbatti. You can use the agarbatti, ignite it, and then just apply to the, how for the crackers we normally touches to the tip. In that way we can do it. But otherwise the moksha, this also how the agarbatti is there, like that you can find. This is the moksha, small moksha. How there is a cigar, cigar means is a cigarette, like that this is the small cigar. You just ignite this, it ignite marikodi. You ignite this and then show to this moksha cigar. This burn ಮಾಡಿ ತೋರಿಸಿ. So we'll try to show you how to do that procedure, how they are showing in that way. You just do it and then place it. So once you place it in this way, you just burn it to the moksha cigar. This is a delicate and complicated. You should be very, very careful and ignite in this way and then place it. But already what is existing? Downwards there is a hollow is there that reaches to the bottom of the husk, that is connecting to the stomach as well, directly and then indirectly. So after that the patient repeatedly asks, after doing the Moxibustion, you shouldn't go from that patient, you shouldn't move from that patient place. You should sit comfortably, don't stand. If you stand you cannot do it, but aram se you make it as a chair, separate chair on next to the bed, and then sit comfortably, ignite it, and then further you try to see that the patient is comfortable. You have moved somewhere else, then you are coming after 5 minutes, the lower portion of the skin will going to burn. That shouldn't happen, right? So in that way we try to see that ignite to treat for the abdominal related disorders. Once completed this procedure, then what need to be done? So you need to cover that after taking. How to take it out? With a spoon. So once you do that, once you apply it, then you have to take it as a, with the support of the spoon. Now for example I ignite it.
In this cone moksha, can we use ginger as the base?
Yes, definitely, that also possible. Now it is burning on my hand. You take the support of the spoon, you take the spoon support, and then you just dispose in the kidney tray. Always you keep it as a kidney tray next to you and then dispose in that. In that way that can be possible. So spoon are the two types of the spoon. One is spoon is this time, the other one is the fork. Fork type is there, no? Fork also good. You take it smoothly with the fork and then you just put it into that. In that way that can be possible. And then after finishing this, you have to cover that, whatever folded that towel, the folded towel you just bring and then close to that region. Why did you do the Moxibustion? To warm up that area, to strengthen the flow of the energy on that particular region, in order to improve the circulation of the blood on that region. Once you do that, after that don't again open up that area, and immediately you just cover not the costumes which you are using, but this the cotton woolen cloth, you just close it the entire region to bring the warmness on that region for the maximum time. So at least for 30 minutes you just cover, or the 5 to 10 minutes minimum, you just cover that region and then leave it. In that way is it possible to do that Moxibustion on the abdominal region. This called as a direct Moxibustion. But what clinical conditions this situation is using over this region? But you can have a look. These are the areas where they have placed the points. This is the navel, the deepest navel. Navels are different types of the navel, and this is kind of the oval shape of the oval deep hollow navel, right? So this is the proximal to this region, Which point this point has been placed? So come on guys, anyone?
ST25.
No, I mean to say this cone.
CV6.
Range 7. Range 7.
CV12.
Good.
CV6 and CV10.
Yes, this is the CV6, then CV9, and this is 12.
CV12.
Right. This is, as you rightly said, stomach.
25.
Yeah, 25.
25.
And this also stomach 25. So this entire region, what could be the reason to place this? What are the indications you can use this?
Constipation.
For
Diarrhea,
Constipation.
chronic diarrhea, or
Diarrhea, constipation.
gastric problems.
Yes, anything connected to that abdominal system, anything connected to that dysentery, diarrhea, constipation, abdominal pain, worms infestation, solar plexus got changes between the each other, upper shifted or the lower shifted or something, or the umbilical cord having some problem, infection inside on that situation. So any related to the abdominal, coldness get excessiveness, diarrhea could be reason, cold get excessiveness conditions. Definitely you can use this moxa cone for some period of time. Maybe one cone is you place it, the heat is appeared for 5 minutes, then you dispose again after some period of time, one more cone is placed, at least 2 to 3 cones applied one particular time until the patient reaches the maximum heat. Yes, now, yes, I feel the heat now. Okay, I can bear, but still, yes, little more heat is there, but still I can bear. But now I feel, yes, excessive heat. But that situation, put it the spoon and then take it outside and keep it water next to that situation. One mug of the water always next to that. If you don't have the water, but you shouldn't test to moxa. Keep it that in your mind. Water should be next to the bed. Right. In that way, you just do it. This will be one type of the direct moxibustion to be given on the abdominal region, isn't it? So, or you wanted to use the moxa cone also applicable. You just ignite it and then place it on the specific region, on the abdominal region for a few times. How to do this procedure, I'll try to show you. Now you can see, Tonsi. Now I think 5 minutes got over. The entire moxibustion has been burned maximum. Show to everyone.